Hi there. Hello there. Welcome to another episode of A Tale of a Life That You Can Be Thankful Isn't Yours. I thought about just talking basic symptoms today. My back is hurting, and that makes me very anxious because the same patterns of lying on heating pads and having to sit in different places and have a heating pad or something on my back, salon paws or whatever, because when I had to have my spine fused with a titanium cage placed twice, these are all behaviors that precipitated that event. And that event occurred by me having back pain. That's why I see a pain management doctor. But something was different, I could tell. I stood up from my bed and immediately collapsed on the floor. And the reason why that time was because I lost L3, 4, and 5 in my spine. So I have a titanium cage in there, which will be in my back for the rest of my life. And the condition precipitating that is called multi-inflammatory syndrome. So I've been having these joint, muscle, bone symptoms. It started the first time I was in the hospital. Went to doctor after doctor, orthopedist after orthopedist. No answers. No suggestions. One of the docs that I went to came in the room, said, just do PT, physical therapy. I said, but it's been 4 months straight of me taking aspirin, ibuprofen, Tylenol, Aleve. What else is over the counter? Topicals, anything you can think of. And the best part is, the good ones, the anti-inflammatories, kill your kidneys. So I needed something different than the things I just mentioned. So he didn't spend 5 minutes speaking to me. And he goes to brush me off, walks out of the room. No, come back. I have a question. He barely leans his head in the room and says, what? I said, I need my kidneys. I'm a diabetic. I have been taking NSAIDs, which is the class of drugs like ibuprofen falls in. Those are the ones that affect your kidneys. And I said, for 4 months straight, I've been taking those around the clock. They're not working. They give me minute relief. And he says, buckle up. He says, are you vomiting blood? Now, this face is like, you may think it's a look of confusion. I knew instantly where he was going. I said, that's a ridiculous question. He said, I don't write narcotics. Oof, the Italian came out. I said, did I ask? Did I ask? You could write me for medications, prescription meds that are not narcotics. But you base your care off of me vomiting blood because his point was ibuprofen can give you ulcers, which is why it's recommended if you take ibuprofen, you eat crackers or something with it. Sorry, I'm gonna grab my New Orleans mug, take a sip and calm down. I said, your criteria for good health care is to come back when I'm vomiting blood. I can't wait to get the patient satisfaction survey. And I walked out. Didn't say a word. I can't make this up. This is the industry that I loved being a part of. So I got to see it from the patient side so many times. And every time some interaction like that happened, what happened up here was not everybody has this mouth. Not everybody is going to talk back to someone in authority who's being a complete and total jerk. But I do. And I will. And I did. Vendi vidi vici. I went to 4 doctors. I crawled to 4 doctors to get help. No one. Finally found one who did an MRI. Pulls it up. Still have the pictures, the images. He said, do you see these 2 bones right here? And you see here, he said, this should look like a hamburger in your back, meaning your discs cushion in between your vertebrae. He said, your discs are bulging out instead of staying in place and cushioning. keep an eye on it. Keep an eye on it. Keep an eye on it? Okay. Just keep an eye on it. What do I do for the pain? Because when I would walk, every step, having the disc not there to cushion it, my bones were well, you have to find a pain management doctor because we don't do any. I got the whole speech over again, and I was just like, "Oh my God, this is medicine. This is my career. Have I done this to someone? Was someone on the receiving end of this that I treated this way, and I'm getting just desserts now because of my history? Oh my God." So then began my journey to find a doctor for pain management. Again, pain management doesn't mean opioids or narcotics, number one. Number two, I don't want opioids or narcotics. Why? Because I'm going to get addicted to them? No. I want to start base level because I don't know what is going to happen. Let's save the big peacemakers for later. We'll pull out the big peacemakers for later. But for now, the times I was told to do physical therapy, you do realize I have to crawl to get here. Pointless. So I went to one doctor, two doctors, three doctors. After the fourth doctor, I said, I can't do this. I was back to the beginning of no one believes me. Even though I have an MRI that proves it, you have evidence. And I'm telling you, and you can look and inquire because the DEA, because the DEA is on everybody's ass. You can pull up my prescription history. I challenge you to find a narcotic, an opioid, in my prescription history for the last 5 years. You gonna accept that challenge? Go look in your computer, because I know doctors have access to all of my prescriptions. How do I know that? Because I had to do it in the ER. When people would come in, we would get their prescription history and see, well, they're back here for pain. They tell us I'm out of my pain medicine. I look it up. But you just got 190 pills 3 days ago. Where are those? You are telling me the exact dose, the order you want the meds in, how quickly to push the meds, and without coming off as judgmental. It's a patient safety issue. If someone has 180 pills of whatever narcotic medication a doctor prescribed them, perks, oxys, whatevers, if you have prescriptions, we can't give you anything stronger. They don't make anything stronger. And if you go to a doctor who prescribes that to you, you have to sign a patient agreement acknowledging you won't doctor hop, you won't go to pill mills, you won't do all of that stuff. And if I hear one more person call the F drug fence without the CE, ta, null, I'm gonna come through the TV screen. It's nil. It's not null, it's nil. And people abusing it is gonna make it just that much harder for cancer patients, for patients with legit conditions to get pain medicine. I said, I am going to one more doc, throwing in the towel. I don't know what that's gonna look like, but I can't do this. Made an appointment with the doctor. Oh, there's one right here, like 2 miles away. Called the office. They said send over. And it's like applying for college. You have to send like an MRI, a CT, x-rays, that you have to have studies, doctor's H&Ps, doctor's notes and stuff. And then they review it and make a determination of staying, whether or not they want to take you on as a patient, basically. Applying for college. I mean, that's what it felt like. And I had to do that, like I said, I did it 4 times. I had to, again, call this 5th doctor. I already had everything in my phone, sent it all over. The office called me back. Now, I'd been turned down, keep in mind, 4 times. No, 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 you're fine. Okay, well, sorry. I try not to get made an appointment with the doc, and loveliest gentleman I have ever met. I was not judged. I was believed. He saw my studies and even said, "Pay attention to the following symptoms." I made it I've probably been seeing him now. I have no concept of time or dates or anything like that. Like, everything is a blur. I have no idea. But I've been seeing him for at least 2.5 years. So that would be like somewhere in 23, maybe 22, somewhere around there. Probably 22. Something like that. Anyway, so wrote me for meds. Did it take away my back pain? Mm-mm. That wasn't my expectation either. My expectation was just like make it tolerable. So he did. He did. And continues to. Because if I told you the medications I have to take every day, you would wonder how I am able to keep my eyes open. It doesn't faze me. A misconception that people have: I don't want to take pain medicine because I'm going to be addicted. No. If you really have pain, it won't happen. It's when you abuse it because you want to feel that fun vibe that pain meds can give. And that's the other thing too. I told my pain management doctor, who I love to pieces, I said, I am fully convinced the genetic component of an addiction is not in me, because I don't get those sensations of woohoo, woohoo, I got purple drink on board. And you'll have to Google purple drink if you don't know what it is. I don't get that because the meds are too busy squelching my pain. So now that a part of my back is starting up again, makes me scared. I have to take my pain medicine immediately because pain makes me start to yak rainbows in the toilet. It's a trigger. Pain triggers the cyclical vomiting. So I have to take it first thing when I wake up to just make it tolerable. Not to make it go away, make it tolerable. When I was in the hospital the first time, spinal surgery. When I collapsed, I could not walk, paralyzed. Like, your lumbar area couldn't move my legs. I couldn't stand up. EMS had to come in, put me in a sling, and carry me out of my bedroom. That was the first time. Then went in and had surgery. Then 2 weeks later, I get up to go to the bathroom. Bam, I'm on the floor again. But this time I crack my head again. How many times? Thank God I am hard-headed, which I've heard my whole life. God, you're hard-headed. You could argue with a fence post. Yes, I could. And I will wear that badge. The second time when I collapsed, I couldn't move and I was screaming in pain. Screaming. Was in my bathroom. Mom tries to come and help me. My son tries to come and help me. I am freaking out because I can't walk again. EMS came back. They're standing in my bathroom. Do you think you can get up? Let me, just leave me. I was about to say the word that would probably get me banned, but I said, please, like I was begging. But I caught a glimpse. My mom said my name in a certain tone that made me look over, and I saw my son crying. And I knew I had to get fixed. So again, I have to be put in the sling. This time, the pain was so intense. It was... We used to have a pain scale, like a fake pain scale, where a 10 was having a bear rip your arm off. I wish a bear would have ripped my arm off because, ugh. And I was like, don't do this. And they had to. They called the fire department. It was a female paramedic and a female EMT that responded. And I could hear, so I'm in my bathroom. I could hear when they showed up, and the paramedic was briefing the fire department on what was going on. And they were two girls, so not that they couldn't lift me. You need more help, because when you have somebody who fell and hit their head, you have to be super careful. You have to stabilize the spine because you don't know if there's any damage. So, always, I cannot shut it off. The way I tell stories or my observations, I heard the female paramedic tell the fireman, she's little, y'all be able to pick her up. And I thought, oh, that's sweet. I was in the middle of a crisis, but the fact that this paramedic acknowledged the fact that I wasn't a giant person. Oh, God. It was funny. I can still hear her saying it. Oh, she's little. Y'all could do it. And I was like, thanks, friend. So I get transported. and they do an MRI. A complication of spinal fusion is a condition called cauda equina. Again, I will let you Google that to explain it. That is what I had. I also had a fluid collection in my back in the area of the cage. That admission. So let me finish that thought. Sorry. I had to go back to surgery because of what the MRI showed. They had to go in, open me back up, do what's called a washout, clean it, whatever. Because the titanium cage is my spine. It's my spine. Clean it out, see if there's anything, culture it, whatever. So in talking to the surgeon, I said, what caused it? What is this? He tried to say, well, you are a diabetic. So I said, stop right there. You're looking at the wrong diabetic, sweet cheeks. My A1Cs are perfect. I take care of myself. 41 years of being a diabetic, 0 complications. You're not going there. Because I guarantee you, when you culture that, it's going to be negative. Cauda equina. The reason you want to go with, oh, she's a diabetic and she's old, the shit that happens, is because it's cauda equina. Could the surgeon have done something different? I had my second surgery. And the idiots forgot to put insulin back into my body. So not only did I get 2 back surgeries in 2 weeks, they also put me into full-blown scary DKA. That experience alone should be a mortality and morbidity presentation. In teaching facilities, they called them M&Ms. You review a case. It could be a death. It could be something went wrong. What can we do better? That kind of thing. What could you have done better? Squirted some insulin in the air, and maybe I could have inhaled it and not have been on my deathbed. Because the second time I was in the hospital for over a month. ICU for, I don't even know if I got downgraded. Did I had to have, because I had to go to rehab. So spent the beginning part, I was so unstable. I was in the ICU. Got moved to a surgical floor and then to the rehab facility. I almost signed out against medical advice. And this hospital has a reputation. So I'm going to leave Easter eggs and let you figure it out. The hospital system is the hospital that President George Bush and Mrs. Bush went to. And I am not in the medical center. And boy, does it show. I am telling doctors what to do. The stories are endless. I was there long enough. Had to be followed by infectious disease because they were so convinced this pissy diabetic caused all of this. Infectious disease doc came in. I was on, oh my God, antibiotics constantly. Even said to the nurse, I'm getting a yeast infection from the antibiotics. I need diflucan. And she said, do you mind if I just take a look? And I said, knock yourself out. So I'm spread eagle, and she goes, well, I don't see anything. And I said, you know all the antibiotics I am on. It's not rocket science. And keep in mind, this is the ICU. The nurses are supposed to be able to think up here. They do a UA, urinalysis. Guess what it comes back as? Yeast. I said, can I talk to your charge nurse? Charge nurse comes in. Because they all know before they walk in the room, they give each other a report. First words, I guarantee, out of their mouths, she's an ER nurse. And they immediately are like, ugh. So I said, I need to talk to your charge nurse. So the charge nurse came in, and I said, I need you to look at the nurse who took care of me, because this was, I think, 2 nights after I made the comment that the urine culture came back. I said, I want you to tell that nurse I told her I was getting a yeast infection, a fungal infection. I am so immunocompromised right now, I can't afford that. Diflucan, I was on 85,000 antibiotics just ask for it. I said it took 2 days for me to be able to say to her, ha, I told you so. So I need you to relay this to her, because it won't be nice if I have to. And you can get fungal infections systemically. It can happen anywhere. My wound, it could have been fungal, like, whatever. So, again, the hospital forgot to put you on insulin? Did they know you were diabetic? Please, I was just here 2 weeks ago. Did they think the cure was found in those 2 weeks? No. I am still a diabetic. Y'all had to make me, I had to take my earrings out, my watch off, all of that for the MRI, including my insulin pump. You fools didn't order insulin for me. And no one was curious as to why my blood sugar was 300? And again, this hospital, not in the med center, we're out in the west side of town. They are trying to make a med center west, where I live. I told them, if this is the staff and the friggin' doctors that are going to be in charge of my life, I will take my chances and go to the med center and sit in the waiting room for 20 hours before I allow any one of you to touch me ever again. That admission, there's so much more to unpack on that one. Woof. Woof. So today, since I'm feeling kind of, I just have to get out of my head and, you know, figure out what can I do to get out of that headspace. So hopefully tomorrow will be a good day. Meds are helping. And the funny thing is I will take my prescription meds and then I take over-the-counter meds for breakthrough pain. And it should be the opposite, but that's what works for me. So, whatever. It is what it is, and it ain't what it ain't. So, peace to everyone. Subscribe, share it with your friends if they have weird symptoms that, oh, sounds like me a little bit. Her fatigue, her brain fog, her this, her that. I'll talk to anyone. Because my dogs don't answer back. And my son said, if my hair were blonde, I would have a Karen haircut. So it's not blonde, so I guess I don't have a Karen haircut. I don't know what that means. It's deceptive because I have it tucked behind my ears, but that kid So this Karen haircut is going to sign off. Till next time.